Okay. Good evening, ladies and gentlemen who have joined us on this Dr. Fundi channel via Facebook, YouTube, Twitter, Instagram, and also the Dr. Fundi website. My name is Fundi Lenyati. I'm the host of this channel. Today, being a Sunday, we normally call it a Salute Sunday. It's a day where we invite somebody who's doing great things in their chosen field. We've had people from the medical space. We've had people who are business ladies. We've had sports people on this platform. Today, we are going to host Dr. Nomthandazo Dube. She didn't know that I know the other name, Amanda Dube. Well, she goes by the name Dube Neuro. And also, in one of the interviews, I saw that they refer to you as Dr. Ginger. You're going to tell us why they call you Dr. Right. Right. Dr. Nomthandazo Dube is a specialist neurosurgeon who works at the Dr. George Mukari Academic Hospital in Garankuwa, northwest of Pretoria, South Africa. In another interview that you did recently, you were referred to as a kick-ass neurosurgeon. So just decide to give you names. I have to tell us why Ginger and why kick-ass neurosurgeon. But what's important, the reason why we invited you today is that you are a trailblazer. You were the first female Black neurosurgeon to be trained at the Sefako Makgato University and went on to pass the fellowship exams in neurosurgery. So you are that glass ceiling breaker in an area where males tend to dominate and make sure that females don't get to break those ceilings. I also found out that you were just 1 out of 10 neurosurgeons, Black neurosurgeons. I'm not sure if I'm right. And one from
sorry.
KZ. Is that true?
Well, at the time when I graduated, there was 10 Black female neurosurgeons, and there was only 3 from KZN.
Lovely.
But
lovely.
Since then, we've made some strides. So there's quite a few Black females that have since passed, since we had that statistic.
Beautiful, beautiful, Doc. So yeah, I'm still just telling people about you. So just relax. I want you to
okay.
relax. It was a bit hectic to start here.
Yes.
I think, yeah, so Dr. Dube has got a special interest, in the area of neurosurgery. She's got an interest in neurotrauma.
Yes.
She'll tell us what that is in pediatric neurosurgery, brain and spinal surgery, neuro-oncology, vascular neurosurgery. And she does some RAF work, medical legal work as well. She had obtained her BSc in Medunsa, MPCHB in Medunsa. So she studied for 8 years before she became a doctor. And she decided she still wants to study more and spent many other years to become a neurosurgeon. So, Dr. Dube, welcome to the Dr. Fundi channel.
Thank you so much. I feel very, very welcome.
Coming from KZN, you must have Istagazelo, a clan name. I always want, to know people's clan names. So before we start, we need to know what's your clan name, so we can invite those invisibles, to be here with.
Yes, Udube Mbuyazi Mageza Ngobisi.
Thank you very much, Doc. Thank you very much. Right. Welcome. And I must also welcome all our guests, all our viewers who have joined us via those many channels. Apologies for the late start. Sometimes things happen which are outside of our control, but the beauty is that at least it was not African time. So we didn't take an hour, it was just over 15 minutes, but still we apologize for that.
Yes.
Right, Doc, today I just want you to tell us a little bit about yourself. I know when we Google you, we'll see neurosurgeon and all the good things you've done. But in most times, we don't get to know the person. Where was she born? What kind of family? Is she a last born, first born, middle child? What kind of family environment she grew up in? What were the influences within that family setting or even the community where you grew up? So I just want us to briefly start there because, yes, we will focus a lot on your major achievements, but just to know who are you and where do you come from?
Okay, so I am a girl that was born from the township of Imvali in Pietermaritzburg. I'm the last born of 3 children, so I have a brother and a sister, and my parents are still together. My mom is 72 now. My dad is, I think my dad is 75 now. I had probably one of the best childhoods, playing in the streets, magaloba, hopscotch, the works. Growing up in a township, it was, I have nothing but good memories, from when I was growing up. When it comes to influences, I always say when we were younger, or when we were growing up, we really didn't have any role models. Our role models were actors and actresses, but I didn't know any professionals as such. I knew that there was a general practitioner in the township, but I didn't know any specialists. I didn't really know any Black professionals as such. So I didn't really have role models when I grew up. I sort of started having role models or started thinking about role models when I was in university. I went to school in Pietermaritzburg at Alston Primary, and then my parents decided you need to go to boarding school. So then I moved to Little Flower in Itopo, where I went to boarding school, and it was a Catholic school, very strict, but one of the best years of my life.
I actually know somebody who went to the same school. I'm not sure if it's at the Deputy Public Protector. Went to Little Flower in Itopo, I think.
Yes.
So it seems like a school that is producing a number of top professionals as a school.
It was, we received very good education. I mean, it was a public school. I didn't, but it provided some of the best education. And like I said, it was some of the best years of my life.
Beautiful, beautiful. And just at the family, within the family setting, what would you say are the 3 key values that still drive you today, that have made you the person you are, from your mother or from your father or from both of them?
Okay, my parents are really hard workers. So I've always watched them work and give us the best that they can. My father is, he started working for a retail company. And then at some point he decided he's done working for somebody else. He wants to make it work for himself. And without, a second thought, he left that job and he started his own small business in the township. It was a small tire business. So he would go and he would buy secondhand tires, etc., and he would sell them. And that's what put food on our table. And that's what put me through school. And my father instilled in us hard work. So during the school holidays, I would actually work in the tire business, and not behind the till, not sitting glamorous. My father was like, you're going to be outside. You will patch a tire. You will patch a tube. So as a result, I know how to change a tire.
I was about to ask that because many ladies, they would rather call AA or what's the other one? you know, the
Yes.
guys from my way to come and sort out their tires.
Yes.
So you can change
No,
your tire.
no, I can change a tire. I can balance a car. I was taught how to do wheel balancing.
Yeah,
So I used to work for my pocket money. So for me, hard work is very important.
beautiful.
And also perseverance. You know, my parents, I remember them building our house in the township. You know, they had a dream to have this beautiful big house, and I'm sure it took them almost 3 years to put a roof on the house. So we sat with this half-built house, but they never gave up. You know,
Mm,
they wanted to have this house, and eventually the house was built. We lived in it, and it was, you know, one of the most beautiful houses in the area.
yeah,
And you know, it was all about perseverance, not doing things, you know, above your means, taking your time. So
yeah,
those are the values that they have been instilled in me, is that
yeah,
hard work, you have to dream, and you have to be willing to work for it, and also be patient.
yes. So when they look at you now, do they see a product, you know, of those teachings from home? Are they proud? Because you know, if I was a parent, I would be super proud.
Well, I hope that they're very proud. They always tell me that they are, and it really makes me happy to see them smile. I mean, you know, on my graduation, they were just beaming.
Yeah.
Yes.
Lovely, lovely, lovely. So, Doc, you went through, you know, school at Little Flower. Did you also, you know, do your high school there?
Yes. So I did my primary school in Pietermaritzburg, and then my high school was in Little Flower, which was the boarding school. And
Yeah.
then from there, that's when I started applying for medicine, BSc, etc.
Yes, I was going to ask you because I see that you started doing a BSc at Medunsa, and once you
Yes, I
completed
did.
that, then you did medicine. So,
Medicine. Yes.
is that because you were not yet sure when you passed matric what you really wanted to do? So you were still buying time, or why did you start with a detour via the BSc route before you went to the MPCHP?
Okay, so basically, when I applied, I didn't get into medical school. My first choice was medicine. So I applied at a couple of institutions. You know, one of them obviously was UKZN because that was closer to home,
Yeah,
and then it was Medunsa, and I think I also applied to Wits.
yeah,
But I, for some reason, you know, I couldn't get in. And when I then went to Medunsa, they said to me, "Look, why don't you go into BSc, do the BSc, apply while you are here. So while you're doing the first year, why don't you apply?" And I started doing the BSc, and I started enjoying it. Eventually, you know, so I started the BSc, then I started enjoying biochemistry and chemistry. So it, you know, then I thought, you know, why don't I just finish it? Because maybe this is what I actually want to do. So I actually did, you know, finish the BSc, did majored in biochemistry and in chemistry. And my professor at the time wanted me to stay. He was like, you know, why don't you stay? Let's do research. But,
yeah.
you know, there was a little thing in me that said, I do want to do medicine, you know, because all through high school, that was the thing that I had wanted to do. So even though I could have stayed in BSc, once I was in final year, then I applied for medicine and I was accepted and decided to go for it.
And so you went in at second year level, I think, did you?
Yes, I did. I did.
All right. So you started with your anatomy and physiology, and how was the, you know,
Yes.
getting into the thing that you really wanted, you know, which is now medicine. So how was that transition and actually doing what you wanted?
It was a little bit difficult for me because, you know, when you come from a chemistry, biochemistry, and mathematic background,
Yeah,
the thinking is a little bit different.
yeah,
So I had to sort of switch gears in a way.
yeah.
So chemistry and mathematics is very analytical, you know. And when I got to anatomy, now they're giving me a cadaver, and I'm just supposed to know what this nerve is. This is where it
Memorize.
is. This is how it runs. Yes, memorize it. And you know, it took me a while to transition into that, you know, from working out a formula to, okay, this thing is called a muscle. This is called, this nerve. But it didn't take long. I enjoyed dissection, even though we used to smell of formalin all the time. And everybody knew that you were second year because you smelled like the formalin. But it was very interesting for me.
So dealing with cadavers was not an issue with you, because I know of people who went in to do medicine, but they could not last because the idea of having to cut out, a dead body for the whole year, was not something that they liked. So you didn't have a problem with that.
No, not at all. I found it so interesting, and to such an extent that we used to go and look at other people's cadavers as well. So if you've got a female cadaver, you'd go have a look at a male cadaver and see, what are the differences and things like that. But no, I didn't have a problem. I was at home, with the cadavers. There was no issues there. I mean, and in second year, you get given the bones as well. That little bag of bones where you go home and you've got a skull, a human skull. You've got a humerus, you've got a femur. Yes, and it's all sitting in your house. And actually, I have a skull in my house at the moment, and it sits in my lounge because now and again, even now, post-grad, you still have to look at that skull, because when you're planning for surgery, you go back to the basics, you go back to your anatomy. So I went back to the anatomy department, and went back and asked for my skull.
Yeah. Is it the same skull that you were using then?
No,
okay.
It's not.
All right.
It's
I thought
a different one.
Said, there's the skull that, from the cadaver that we used to, work on. But now the other thing.
That would have been nice.
Is, so in the early days, in anatomy, at the dissecting hall, you'll find that when it's time for people to go and eat, they will spend time washing, brushing their hands, but towards the end of the year, they don't even spend like 15 seconds washing their hands.
No, we didn't care. By the end of the year, it was like usual, we didn't even think about it. By the end of the year, you just got up. When it's lunchtime, you just got up, took off your coat, took your bag, washed your hands, and off to the cafeteria, and you ate. We didn't think twice about it. Hey?
Yeah. All right. So when you reflect back on your medical, undergrad medical training, what would you say are your highlights during that 5 years of undergrad medical training? Doc?
If I'm allowed to say
Hey, Doc?
University. Hi, hello?
Yeah, no, I can hear you.
Oh, you can hear me? No, I said I'm not allowed. I'm not sure if I'm allowed to say I used to enjoy the parties.
Oh. Well, you need a balanced person. It can't just be about books alone. But the question this time was more around academic side. But we're gonna come to the social.
Yes. No, Medunsa was very clinically oriented, So when I left, I had a lot of skill, So I think it was quite balanced in terms of a little bit of clinical work, as well as you need to know the theory. But when we left, we had a lot of skill. I found that they concentrated a lot on our clinical skills. So when I went to work as an intern in a semi-rural hospital, if I should say so. Emadadeni, yes. I mean, it's not entirely rural, but obviously, Emadadeni, we didn't have as specialists. We had probably about 2 or 3 specialists, but when you got there, you needed to jump in with both feet, and it really helped that I had gotten a lot of clinical training as a student. Yes.
Yeah. All right. So on the social side, were you the person who was the life of a party?
course. No, I'm joking. I just enjoyed being a student. It was one of those times where, you were learning to be an adult. Parents were not there, we could set our own rules, come home at any time. So I think it taught me a lot about adulthood. I learned about myself when I was in varsity, a lot of the things that I like or not like. So it was, I loved being a student is, geez, I wish I could go back to being a student actually.
The only responsibility being just to pass and acquire knowledge.
Yes.
Other people must worry about other things.
Yes, and ask your parents for money. Like, you don't have money, like, please, can I, now you have so many responsibilities. I can't ask my parents for money anymore.
Yeah. All right. But anyway, Doc, so by the time you finished your undergrad, before you went to Madadeni, did you already know what specialty you wanted to pursue after you've done your internship and ComServe?
No, I didn't. So my plan had been that I was going to finish school and I was just going to work in a hospital and I was going to work in an outpatient department. I had no plans. I was done studying. I had actually said to my friends that I would never go back to school. But what happened was, in final year, I became friends with the registrars from neurosurgery. And started talking to them, was a little bit interested in what they were doing, but I still had no plans to do it. And when I went to Madadeni, one of them said to me, one of the neurosurgeons that had qualified said to me, look, for extra money, why don't you come and assist me? So I said to him, okay, it's fine. When I'm in Gauteng, I'll come and assist you. And it became like a weekend job. So I would drive up to Gauteng and I would assist him with the operations. And it just became my favorite thing, And I always tell people that the first time I operated with him and we removed the bone, the scalp, the skull, I looked at this pulsating brain and I thought it was the most beautiful thing I'd ever seen. And I was hooked from that day. But I still, didn't think I had what it took to become a neurosurgeon. So, throughout internship, throughout community service, I just continued assisting. And at the end of community service, I started running an HIV clinic in Madadeni, in Newcastle Provincial Hospital. And I became very bored. It was, I realized that it wasn't for me, actually. And at that time, that's when the post came out and I thought, okay, let me apply. So I basically applied for every post that was in the newspaper. But I didn't apply for neurosurgery because in my mind, I thought, what a difficult specialty. I'll never be able to, I don't know anyone who's a neurosurgeon, least of all a Black woman. I probably will never pass. So I'm not going to apply. But the guy, the doctor that I was assisting said to me, no, why don't you apply? You seem to have such a good grasp of it. And so on the very last day of application, I actually took my application form and I said, well, we'll see. If they take me, they take me. And at the time I gave myself 6 months and I said, if they do accept me, I'm just going to go into neurosurgery for 6 months. If I don't like it, then I'll leave. And I think it was a week later, they phoned me and they said, please come for an interview.
Yeah. And you went for the interview?
Yes. So where the Dr. Ginger comes in is I've had blonde hair for a long time since I was in Madadeni.
Since Madadeni,
so when
changing the different types of hairstyles, but
the
thing is they are ginger.
Yes. So when I arrived for the interview, I came in with platinum blonde dreadlocks, and I walked into there, and I was the only woman in the interview, and there was all these really tall guys sitting there, and they said to me, one of them said to me, have you been in a neurosurgery program? And I said, no. And he said, oh, okay, well, I was working in the neurosurgical unit, and I thought, oh dear, they're not going to take me. Yeah. But I still went in for the interview. And I mean, a couple of days later, they called me and they said, please serve notice. We'd like you to join the program.
Yes. What do you think are the reasons, I mean, in that interview, what do you think made them to choose you as opposed to the other guys? Remember, they had a bit of experience, but there's something. This question is directed. I want to get to your personality, because again, in one of those interviews, they talk about the bubbly, the doctor, the ginger doctor. So, what is it? Do you think your personality played a big role in actually, getting these guys to say, you know what? I think she would be good to be part of us, and maybe break the androgen, levels that are too high, and also just bring us energy. But what do you think, on a serious note now?
I do think so. I mean, I was unapologetically myself in the interview. Like I said, I came in with blonde hair, I mean, somebody could have taken one look at me and said, what kind of doctor is this, with white hair, I was unapologetically myself, but, I suppose also my desire, to be a surgeon and to be a neurosurgeon, I think that came across to them. But I think one of the most important things is that they had realized that, there are no women in the department. So you've got these surgical departments that are running, but we're not training any women, and it's important to train women. Yeah. And that was probably, one of the reasons why I was hired.
Yeah. So, but it was not just about, affirmative action for women. I mean, because there was substance, obviously. The fact that you were a woman and with a certain personality must have been a cherry top. You must have convinced them about, I mean, you had already been assisting by that time, right?
Yes, yes.
As the other guy. So you were not like somebody who was completely, clueless.
Clueless. Yes, yes. Yes,
all right.
That's true.
When you got that call that says serve a notice, how was it? How did you feel?
I was scared. I was terrified. But like I said, in my mind, I said, okay, it's fine. Let's do this. Let's try it. Let's try it for 6 months and see what happens. And I was completely afraid, but I was also very, very excited because, I wondered about the possibilities. And so I went through to start. And I remember I phoned and I asked, what's the dress code? And they said, dress code? No, we don't have a dress code. You just have to look professional. And I was like, okay, that's fine. Can I wear high heels? And they're like, well, yeah, we don't know. Yes.
Long surgery, the high heels can be a problem.
Yes, they can. They can, very much. No, I learned that very quickly, that high heels are not the way to go.
Yeah. All right. So, Doc, you then started your registrar training with them. You needed to prepare for your primaries. Yeah. And how long did it take you to go in and pass those primaries?
Okay, so I started my registrar training, but it wasn't as simple as all of that. So the biggest surprise that I had was when I arrived, one of my consultants, first week I was there, very excited, all happy and excited to be in the program. And he says to me, I don't know why you're here, because neurosurgery is not for women. You don't belong here. And I said, okay. Yes, just like that. And he said to me, you're wasting our time and you're wasting your own time. You will never pass. You will never be a neurosurgeon. It's for men only. And I said, okay. And there was another lady at the time that was in the department doing neurosurgery. And, I was sort of confused. Okay. Then why was I taken? But, but I persevered. I was like, okay, well, like I said, if I can't make it, I can't make it. But continued, and the guy was on my case. He would not let go. He made sure that at every turn he would remind me how I didn't belong. He would remind me how useless I am. He would remind me how little I know, how I will never be a neurosurgeon, how being a woman made me not suitable. Then I passed my primaries, and he didn't say anything. And I thought, okay, fine, moving along, we're not going to say anything to him. And I prepared for my intermediates. And the issue that let me not say the issue, but one of the things that he would do is, there's a group of us, but if I make a mistake, for example, I'm in training, so if I make a mistake, he would point it out. He would point it out when there's a huge group of people, and he'd say, you see, this is why women cannot be neurosurgeons, or whatever the case might be. He'd call me and he'd say to me, come and see what you've done, come and see your mistake. This is why you don't belong in the department. And eventually, I rotated out of neurosurgery, because for intermediates you rotate in other specialities. So I went to general surgery, I went to ENT, and enjoyed it, but my heart was always, by then my heart was in neurosurgery. Yes, it was in neuro. And passed my intermediates, and the guy still didn't say anything. He still thought I was a useless human being. He still told me that I need to find another job, that I still didn't belong. I don't know.
Sounds like somebody was very unhappy with himself.
That's what I thought, and I wouldn't tell anyone. And a lot of the times, and I think a lot of people do this, is he would say a lot of these things when it was just me and him, and he would make sure that he would try and break me. And I think that's, the stubbornness in me probably came out and said, I'm going to prove him wrong, And when I passed my intermediates, he still, didn't say anything to me, and I was ready to, and then I prepared for finals. And when I passed the written part of the finals, he then phoned me and he said to me, oh, I hear you passed. And I said, yes, I did. And he said, well, then you must come so that I can prepare you for the oral part of the exam. And, I sat back and I said, I never want this guy to ever say, you are here because of me, and I did have, help from other people. My prof, for example, Prof Lehwara, is one of the people that has always been my cheerleader. He's one of the people, even when I wanted to quit at some point, said to me, you are going to become a neurosurgeon. I will not allow you to quit. And, was always there to help me.
Yeah. So, but that then also proved that not all men are like this guy, I mean, others are actually, they don't have issues with patriarchy,
No, absolutely.
So, but this guy, definitely, he was misrepresenting this gender.
No, he was grossly misrepresenting his gender, because the rest of the department, a lot of the times they even forgot that I was a woman. We got along so well that on some days, if I'd wear a dress, they'd say to me, oh, you're wearing a dress? And I'd say, yes, because I'm a girl.
Right. So, and then you passed your oral without his help.
Yes.
And
without his help.
And then what did he say?
Nothing.
Well, anyway, that's it's good. I hope he learned something out of what he did, but it really was actually very lousy for him. Do you ever meet him?
Yes.
Now that you guys are now colleagues.
Actually, yes, I
we're
do.
We're not going to mention his name. Do you actually?
No, we're not. Yeah, no, we're not going to mention his name. I have met him, and he's actually once actually said to me, would you consider coming to work with me?
Yeah, that sounds delusional.
And I politely declined.
Yes. All right. So when you eventually became a neurosurgeon, doc,
Yes.
you know, one of only 10, and the third one coming from KZN. I think the other one is Dr. Shezi. Yeah, is it?
Yes, she's the first from KZN. She's the
Yes.
first, yes, from KZN. Yes.
Yes, and then there's no, but she's not from KZN.
No, Kotlaiga is not from KZN.
Yeah, she's from Eastern Cape,
So
right?
there's, yes, so it's Dr. Fundi from Eastern Cape. It's Dr. Gilata from Eastern Cape. Then it was myself from KZN. It was Dr. Shezi. Ngobile is, I just forgot Ngobile. Ngobile, I'm so sorry. I completely forgot your surname. She's
So
from
that,
KZN. So that was the three of us.
yes. All right. So, okay, doc. So you passed your neurosurgery. Let's fast forward now. Um, you had proved a lot of people wrong,
Yes.
and you had actually made your parents very proud. Did you invite them to the fellowship graduation thing?
Yes, I did. I flew them to Cape Town. It was a bit of a whirlwind because we got our results on Tuesday and the graduation was Thursday. So, and we got our results Tuesday night. So I had to book flights Tuesday night for them to fly in on Thursday morning to be at the
Yeah.
graduation.
Yeah. And how are they?
My parents were just besides themselves. They were happy. When you look at your parents and they're just beaming the whole time.
Yeah.
They were just the happiest.
Yes. 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 All right. And then your siblings, your brother and sister.
So my brother always offers to fight anybody who does anything to me. He's like, just
Yeah.
phone me, I'll come and beat them up. So
Yeah.
my brother, they are very, very proud. I've always had, I always tell people that one of the best things you can have is support from your family.
Yes.
And my family is absolutely supportive. My brother and my sister, both of them, I can call them at any time. I mean, my sister has been with me through almost everything.
Yes.
I would go to her place and just cry, and I would tell her about the guy that was treating me badly or whatever the case might be. So they are absolutely proud of me as
Yes.
well.
And I understand that you don't stay very far from your sister. Why? Is it
No, I
support?
probably we stay like 7 minutes from each other.
Yeah. Okay. All right. So you've brought home to Gauteng so that you guys can
Yes.
be each other's support.
Yes, in fact, I live with her at the moment. Like after I was discharged from the
Yes.
hospital,
Okay.
I moved in with her because she and my parents said to me they will not let me live alone
Yeah.
until they're happy with the progress that I've made.
Yes.
So my parents wanted to live with me actually, and they said the only way we'll go back to KZN is if you agree to move in with your sister.
Your sister. Yes.
So yes, so I actually live with my sister at the moment.
Beautiful. Beautiful. All right. So we're gonna move now because I wanted us to just understand your journey,
Yeah.
your inspiration, in you becoming a neurosurgeon. You know, now you've been a neurosurgeon since 2018, right?
Yes. Yes.
Yes, yeah, because you qualified as a doctor in 2008, and then you qualified as a neurosurgeon in 2018. That's like 10
Yes.
years later. Um, so you've been practicing now as a neurosurgeon for at least 2 years,
Yes.
right? So then year 2020 came, and
Yes.
we're all happy, all looking forward to great things happening in this year, 2020 vision. So how did you start 2020? What's
20,
your mind as you were starting this second year of being a neurosurgeon?
so I had a lot of plans. I was going into private practice. I had been writing a paper with a psychologist from the USA, which we were planning to publish mid-year. There was a few people that I wanted to collaborate with. I had so many plans. The year was going to be nothing but prosperous and fruitful, and
Yeah,
all these grand ideas.
yeah. All right. And then we all started hearing that there is this funny disease, in China, and we're all praying that it must stay in China and not come this way. But
Yes.
within 2 months, it was in our shores. 5th of March, we had our first case here in South Africa. What went through your mind as a healthcare worker, frontline healthcare worker, obviously as a specialist?
Okay, so I think we were all a little afraid. But one of the things that I thought of as soon as we started getting cases in South Africa was, okay, the reality is I work in an environment where I will most probably be exposed to it. And I remember calling my parents and saying to them that, look, because we are now starting to get patients that are infected with COVID, I'm not going to come home because I'm not sure if I will be exposed to it, if I will not be exposed to it, but to be, and we had read everything about, older people not doing well. Yes, so I thought, I'm not going to come home until the COVID pandemic is done. And, as a healthcare worker, yes, I'm probably going to be, I had accepted the fact that I might be exposed to it,
as an occupational risk.
Yes, as an occupational risk, and I think at the time, the biggest thing that we were all thinking about was, are we ready? Is where I'm working, are we ready, for this COVID-19? And of course, as the cases started rising, we were asking that question more and more, like, okay, this is becoming a reality. We are having more and more cases. Are we ready? Will we be able to fight this thing? And are we going to be able to survive it?
Yeah. So, but now you being in neurosurgery,
Yes.
is there anything in particular within that space that maybe puts you guys at a slightly higher risk than maybe somebody who works in another discipline of medicine?
Absolutely. So remember you were talking about neurotrauma.
Yes.
So for example, on any given Friday, we have head injuries. Human beings can be very cruel, and they will beat each other up, they will stab each other, whatever the case might be. And like I said, we get head injuries. So when a patient comes in like that, a patient, say for argument's sake, it's a patient with a skull fracture. When the patient comes in, the patient will go through casualty, but that's not a patient that you can test for COVID, and wait for however many hours for the test to come back. It's, especially the patient is bleeding, the patient is probably unconscious, they can't tell you, they can't give you any history. So we will swab the patient, but you're taking a risk where you have to now decide, am I going to sit on this patient until the COVID results come back, or am I going to save this patient's life and take the patient to theater immediately? And that's where the PPE comes in, and that's where the COVID ready theaters came in, where you knew that this patient, you don't know what the patient's status is, but you need to save the patient's life because, as my prof said, patients still had other conditions, even though we were in the pandemic, and we needed to still treat patients. We still needed to save patients' lives, even though we were in a pandemic.
Yeah. All right. So, but did you ever think, though, I mean, yes, you acknowledge the risk, but that's one thing to actually getting to be diagnosed with it. We're gonna talk about, how you presented your symptoms and stuff like that. But I mean, your thoughts, at that point might have been, yes, I work in this environment. Most probably I will be exposed, but I am healthy, I'm young, I've got no comorbidities, and so as you are doing your own risk profiling, what did you think?
Like you say, yes. So I did think so, and I think at the back of my mind, in fact, I even said, if I do get COVID, I hope I get mild symptoms. And I think I took it for granted that I would get mild symptoms because I was like, oh, everybody's talking about comorbidities. They're talking about age, etc. And I was like, no, I'm good. I'm not taking any medication. I'm relatively healthy. No, if I get it, I'm probably going to be one of the people that are going to be at home for 14 days and I'll go back to work. And a lot of the people around me that had COVID, that's what had happened. They even if they did, have cough or whatever the case might be, 14 days later, they were fine. So I was not worried. I just thought, should I get it, I'll be fine.
And so how did you start to suspect that, what, something is not right with me? Just
Yes.
those early
Okay.
symptoms to tell you that something is not right.
Yeah, so I obviously, as doctors, we had worked right through the pandemic. And so this was now July and we'd been working nonstop. And I had operated on the Saturday, gone to the hospital on Sunday to see my patients. And Monday morning, I wake up and I'm just tired. And I'm thinking, what, probably I'm tired from this working nonstop. And but I had this headache, this low grade, this headache that was just that was just there, that wouldn't go away. But I woke up, got in the car, went to work. On the way to work, I was thinking, we panicked so much about COVID, I could just be getting the flu. And went to work, saw my patients, and then I went to a fellow doctor's practice. And I was sitting with her and I said to her, look, today I feel weird. Even when I went up the stairs, we have one flight of stairs that I had to go up, and I was out of breath when I got to the top of the stairs. And, I was unusually just tired. And I told her, and I said to her, if I still feel like this tomorrow, I'll probably test for COVID, because I was with my sister and her son over the weekend, and I wouldn't want to expose them. And she said to me, but why are we waiting until tomorrow? If you're feeling like this today, why don't we test now? And immediately she picked up the phone and she called the nurse. Nurse came, did the swab, and I drove home. But even driving home, I was just exhausted. At some point, I remember just wanting to park on the side of the road and take a nap because I was so tired. And I got home, slept. Woke up in the morning. I was actually woken up by the lab at about 6 in the morning, and they said to me, look, we've got your results and you've tested positive. But, I didn't bat an eyelid. I was like, okay, that's fine. I called my sister and I told her, look, I tested positive. Please isolate yourselves, make sure that your son doesn't go to school, etc. And called my boss. My boss was like, it's fine, you'll be okay. Just stay home. I just started making preparations, ordered medication online. In my mind, I was looked at the calendar and I said, okay, I'm going to be here for so many days. Called my colleagues, please sort this out for me, and sat at home. And
so
I thought
10, 14 days.
Yes.
After isolation, you'll be good. Never thought of severe disease and any other complications for that matter.
Not at all. After 14 days, I was going back to work. So for me, I was like, oh, okay, maybe this is the universe just telling me to slow down for a few days. Okay, maybe I'll read a book, watch a movie. I haven't watched a movie in a long time. So, I'm going to take this time to relax a bit. So that was my thinking. And then after 14 days, it's back to the grind.
Yeah. All right. But then things were not like that. So your symptoms got worse.
So my symptoms got worse. I started, I think initially it was the tiredness. I was exhausted. I was extraordinarily tired, followed by muscle weakness. Following day I had the worst muscle pain, where it was even painful to put clothing on. That's how much painful the muscles are. So muscle pain together with the fatigue. And then I just started having progressive shortness of breath. But I didn't think much of it because I was like, oh, well, shortness of breath is part of it. Nothing to worry about. But mine progressed over the next couple of days. Then I would have a little bit of a cough, but it was mostly the shortness of breath. So one of my colleagues who had also been diagnosed COVID positive.
Yeah.
She's a physician, and she had spoken to a colleague of hers, and they had said to us, please monitor your saturation. Make sure that your saturation remains normal. Yes. As soon as your saturation starts dropping, go to the hospital. So we bought a saturation monitor, and on the 28th, when I went to the hospital, I was severely out of breath. Like, you could hear me breathing from the lounge if I was in the bedroom. And because she was also COVID positive, obviously I could interact with her. And so she brought me the saturation monitor, and we checked my saturation, and it was 65.
No, that's hectic.
Which is very low. And I was on my way to bed, actually. I was going to sleep. And, we didn't even say a word to each other. We just looked at each other, and I just started packing a bag, got in the car, and she drove me to the hospital.
You knew that means ICU.
No, it never, even at that point, I just thought I'm going to go to the hospital. At the most, I'm going to get high flow oxygen. But ICU never entered my mind. So I got to the hospital, and I was chatting to the casualty officers, and, not thinking much. And the last thing I remember was being in casualty. And I don't remember anything after that.
It was lights out after that.
It was lights out from there. The next thing I remember is waking up in ICU with a tube down my throat.
After how long?
It had been 2.5 weeks. It was almost 3 weeks.
So from the time you were in casualty to the time you woke up, it was about 2.5 weeks.
Yes, almost 3 weeks.
You were basically in coma for 2.5 weeks.
Yes.
And how long did you stay in hospital, though?
So I was hospitalized from the 28th of July until the 13th of October.
Yeah.
Yeah.
All right.
So that's almost 3 months.
So when you woke up 2.5 weeks later, what was going through your mind?
The first thing was, why am I in ICU and why am I tubed? Why would, why am I on a ventilator? And, it was unbelievable, because the last thing I remember, I was okay. And my thoughts were, did it get that bad that I had to be intubated? But so in my mind, this happened yesterday. It didn't occur to me that it's so many weeks, so many days later. So in my mind, no, this all happened yesterday. I got to the hospital yesterday, and it means I'm in ICU the following day. And I remember looking at, I don't even remember what I was looking at, and they were talking about how it's the end of Women's Month, end of Women's Month and whatever. And in my mind, I'm thinking, what are you talking about? It's not the end of Women's Month. Women's Month doesn't start till it's July. What's going on? Why is this person having crazy talk? And I eventually, I think one of the sisters must have told me, I don't quite remember how I found out that it was actually the end of August. And that's when I realized that I had lost all this time.
All right. And can you imagine if on that day, that 28th, was it the 28th? You had that, because you were feeling sleepy, you wanted to sleep with the stress of about 65, what would have happened there, I know obviously, I mean, it's good that you didn't go to sleep at that point. But then I understand that your stay within ICU got further complicated after you had come out.
My stay was very dramatic. I had one of the most dramatic ICU ICU stays. So I had so before I woke up, I'm told that I had kidney failure at some point. So I had to be dialyzed. My lung was punctured, so obviously I had to have a drain to reinflate it. I developed diabetes. I developed high blood pressure. Then my pressures, in fact, my pressures firstly dropped, where
Yeah.
I had to be put on inotropic support,
Yeah.
on 3 drugs actually to try and, 3 inotropic drugs to try and bring up my,
Your
for
BP.
my heart, my BP and all of that.
Yeah.
And then my kidneys failed. Then I had the strain. Then I developed diabetes from the medication.
Yeah.
Then once my blood pressure picked up, it picked up all the way up, and now I had high blood pressure,
Yeah.
which they couldn't bring down. Despite they tried, multiple drugs, my blood pressure just wouldn't come down. At that point, they were also now worried, and they took me for a scan and found out that I had multiple pulmonary emboli.
Wow.
Yes.
Yes. It sounds like it sounds like that what do they call it now? The storm.
The COVID storm. Yes.
Yes, it
Yes,
sounds
I
like
did.
you
Yes.
did encounter the cytokine storm. With all
Yes, yes,
these
the COVID storm.
multi organs that you were actually
Yes.
suffering from.
Failing. Yeah, failing. And yeah, so I definitely, had the COVID storm, because at some point after I had woken up but was still intubated before they found the multiple pulmonary emboli,
Yeah.
I remember my cardiothoracic surgeon coming in and saying to me, but are you sure that you don't have any comorbidities?
Yeah.
Because we just don't understand what's going on. You are not in the patient profile, that would have so many complications.
Yeah.
It's a mystery what's going on. Are you sure that? And at that time, because I still had the tube, I was writing everything down. I was communicating with them by writing, and I wrote, no, I don't have any comorbidities whatsoever. And I remember one of my friends said, one of the doctors actually asked, is she on like a strange diet that we don't know about, taking some strange diet pills that could be causing all of this?
Yeah.
But no,
but there was no
I was not
explanation.
on anything.
But there's this saying that at times when you are treating a colleague, or sometimes
Yes.
a family member of the colleague, things just go wrong,
Yes.
and in your
Yes.
case, you were, a colleague who
Yes.
was presenting with all funny things that no one could have expected from somebody who had no comorbidities and still young and all of that. But they happened, and there was still more drama coming.
Yes, so then they managed to extubate me, and I was happy. But now the physiotherapist arrives after I've been extubated, and she says to me, you need to sit up on the side of the bed. And I'm thinking, oh, okay, okay, no problem. And the day, I had to sit on the side of the bed, I was drenched in sweat. I could not sit up, I was shivering. I was exhausted. I was breathing like I'd been running a marathon. And I thought, oh no, something is wrong. Why can't I sit up? And she said, okay, tomorrow we're going to stand. And the following day she came in and she made me stand. And when you can feel, when you put your leg down, when you put your legs on the floor and your legs just feel like they're going to buckle under you, like you have no strength whatsoever. And I was standing there shaking, and in my mind I thought, what if I never walk again? What's going to happen now? If I can't stand, it means I can't walk.
Well, at
And
that point, you could, other basic activities of daily living, were you able to do anything?
No. So I'm lying in an ICU bed, and I remember the first time I had to feed myself. The spoon was shaking so much because my hands were that weak. Eventually, I would get tired from eating. Trying to use a phone, because they gave me back my phone. I could hardly type. on the phone.
Mm.
So
Yes.
I couldn't wash myself. They used to sponge bath me. I couldn't
Yeah.
do anything. I couldn't take myself to the toilet. It
Yeah.
was, it was that bad. But I think until I stood up, or until the physiotherapist tried to help me stand up, I didn't realize the extent.
Can I mention something here, just whilst we're at that point?
Yeah.
Now, we've got this common friend, Miss Matolweni, right?
Yes.
So she calls me because Prof. Lungile Pepeta had just passed, after,
Okay. Yes.
some weeks in ICU.
Yes. Yes.
So she wanted me to confirm whether the news is true or not.
Yeah.
But then she then shares that, you know what, I'm actually on the edge because a friend of mine who's a neurosurgeon has been in ICU for a couple of weeks. And so now I'm hearing the news about Dr. Pepete, and I've been praying, for my friend to recover. So that's when I got to know about your situation.
Oh, okay.
From Ritabile, who was
Yes.
really, really, really concerned about your situation. And so the physio came, and obviously rehab needed to start
Needed to
because
start.
if you
Yes.
couldn't do anything.
Yes. And so from the standing, I had to sit out on a chair, and you don't realize how weak you are. And where sitting on a chair makes you tired. Where she says to me, can you sit for an hour? And by the end of the hour, I'm so exhausted. I'm falling asleep on the chair because my muscles are just tired from trying to keep me up. And
Yeah.
then from there, she said, now we're going to try and walk. And that was probably one of the most difficult things I've ever have to do, because your legs are heavy. They feel like they're not part of your body. And I think at that point I broke down a bit, because I was like, okay, am I going to be able to walk if this is what's going on, and I can hardly lift up my legs? What's going to happen? But rehab continued in ICU, and then they discharged me to the rehabilitation center. So the hospital I was admitted at had a rehabilitation facility, and I started rehab there. And what was amazing was I had quite a good rehab team. I had a
I understand we had a
physiotherapist, like I said,
multidisciplinary
multi.
rehab team.
Yes.
Yeah.
Yes.
Who were part of
Yes.
that team? I'm not about the
So I
names,
had,
especially, I mean, the different fields.
yes. Yes, so I had a physiotherapist, I had an occupational therapist, I had a speech therapist, which is a little bit strange because I could speak,
Yeah.
but there was a reason for that.
Yeah.
I had a psychologist, and I had another specialist occupational therapist. So basically, the physiotherapists were taking care of the muscles, the big muscles,
Yeah.
so the walking, strengthening my upper body, strengthening my lower body, etc. The occupational therapists were more about taking care of yourself and my intrinsic muscles, etc., trying to prepare me to go back to work, to be able to live. So they would ask me, do you have stairs in your house? What type of towels do you have in your house, etc. The speech therapist actually was there because she was doing the cognitive functions. So what we've now learned about COVID is that it actually also affects you cognitively.
Yes.
So one of the things that they asked me while I was in ICU, because me being me, woke up, and while I was still in ICU, I asked them for my laptop because I wanted to type something and I wanted to check my emails, etc. And the sister in charge came to me and said, but can you concentrate? And I said, yes, I can concentrate. And she said, no, because we found that a lot of patients that are recovering from COVID, and especially the ones that have been on a ventilator for an extended period of time, are unable to concentrate. Yes. Yes. And also they had been worried, obviously, for my brain. And they had done a scan to make sure that I didn't have any infarcts. So that speech therapist was there for the cognitive part. So she, would give me exercises, cognitive exercises to assess the cognitive functions. I was lucky that I didn't have any fallouts as such, Then I had two occupational therapists, and then obviously the psychologist helped me quite a lot, because it was quite a traumatic experience, waking up in ICU, and being in a wheelchair, because at the time I was in a wheelchair. That was very traumatic for me, and it was quite helpful having a psychologist.
I can imagine you can't do the basics, you can't feed yourself, struggle to go to the toilet. Thinking about returning to your job that requires certain, abilities must have been, something that's gonna be very, very far considering where you were.
Yes.
And therefore,
absolutely, and yes, and that's why it was so traumatic, because you always have it at the back of your mind that, will I be able to go back to work? Will I be able to go back to who I was? Will I be able to live a normal life after this? And also, it's anger, when you realize where you are and what you're going through, because the anger was, I came in with a lung disease. Now I'm in a wheelchair. And I was, in my mind, I'm thinking, here I was working, helping, as much as I could. And now I might never be able to work again. I might never be able to walk again. So there was a lot of anger as well when I woke up. Yeah.
But anyway, the good work by the rehab therapist was actually, getting things better. Things were getting better. But then you started having another challenge. You started coughing.
Yes.
Yeah.
No, absolutely. So work was going well. So I had given my physiotherapist the goal that I was going to walk out of hospital, and we were working towards that. And then all of a sudden I developed this I mentioned it to the look, I have this cough that's irritating me. I'm not sure what's going on. And he said, you know what? Let's just make sure that everything is okay. Let's do a chest x-ray. And we did a chest x-ray, only to find that I had an empyema.
Yeah, which is past on the lungs.
Yes. And we had done a scan as well, and we found also that I had a hematoma, so I had blood. So my liver had been bleeding, basically. So then they said to me, no, look, we need to take you back to theater.
So that's a major setback.
Yes, a huge setback. But at the time they said to me, we're going to take you back to theater for 24 hours. You'll go to theater, you'll go to ICU, we'll extubate you, you'll come back to, oh no, lovely, no problem. And the last thing I remember is speaking to the anesthetist and him telling me, what's going to happen. And off I went to theater. When I woke up, it was almost 7 days later. Actually, it was 5 days later. And I'm back on the ventilator. And I'm back in ICU. And I open my eyes and I think, oh no, what now? And, they couldn't get me off the ventilator again. And I remained on a ventilator for the next couple of days again.
No. This was challenging you. I mean, that's the biggest test. I mean, when I listened to one of your interviews, you talked about the fact that your journey to you qualifying as a neurosurgeon was the biggest, challenge, that you've ever experienced. But I'm sure that was nothing compared to what you were going through.
At the time, I thought that was my biggest challenge. I always thought, wow, I went through so much to get to where I am. But what I went through with COVID is even, I don't know, it's not even comparable. And one of my friends actually said to me, maybe the fact that you had such a difficult journey, becoming a neurosurgeon was preparing you for fighting this battle that you had to fight now.
Clearly, you are a fighter.
I try.
You don't give up, you know, bring it on. I will fight till my last breath.
Yes, I will fight till my last breath, actually.
Yeah. Okay.
Mm.
So you know, after, you know, you got discharged from ICU,
Yes,
for you to then continue with your rehab.
yes, yes.
Did you, you know, have some serious situation in terms of where you had already been
Yes.
with rehab? Where you did you had a major, you know, reversal of the progress, or you were quite okay?
Okay, so my biggest fear when I was in ICU was exactly that, you know, I've made so much progress in rehab and now all of that progress has probably gone down the drain. But luckily when I got back to rehab, I was able to pick up from where I left from and be able to continue progressing.
Yeah,
So that's why my second rehab stay wasn't as long as the first.
yeah,
So when I got back to rehab, I had been working with a walking frame,
yeah,
and I think it was a week on a walking frame. And then my
yeah,
physiotherapist said, no, we need to progress to crutches.
yeah,
And we progressed to crutches. I was on crutches for about a week. And then she said, now we're gonna give you one crutch. And
yeah.
then that crutch goes away
Mm,
because you told me that you want to walk out of here. I'm
mm,
going to make sure that you walk out of here. And then once I graduated from the one crutch, that's when, I started walking a few steps.
mm.
And I used to say to my friends, I'm walking, but I'm walking like a toddler. I feel like I'm walking like a toddler.
Yeah,
And yes, because you know, you you you're almost thinking about walking,
yeah,
putting one foot in front of the other, and the body is still getting used to it. The proprioception is not quite there, and all of that. So yeah, then we progressed, and I just continue walking, and um eventually I was discharged on the 13th.
yeah,
But also the nice thing is, the occupational therapist was very creative.
yeah.
So I found myself doing
Well,
things like
occupational therapists are very
tapestry.
creative people in
Yes,
general.
they are. I didn't know this. So I found myself doing things like tapestry, things I'd seen on TV. So I
Yeah.
had to do a tapestry, to strengthen my intrinsic muscles in my hands.
Yeah,
One day they made me make biscuits, because they told me that kneading the dough is very good exercise for your hands, actually.
yeah,
So yeah, so I made biscuits. They made me make a fruit salad because they said,
yeah.
you are going to hold a scalpel, you need to be able to cut.
Mm,
So I found myself cutting up fruit and making fruit salad for everybody in rehab.
mm,
And one of the nice things also that they did is they requested that we get suture material, a needle holder, etc., and we got a sponge. And I sat and I sutured that sponge, so
mm.
that I'd be able to see if I'd still be able to suture. So I sat and I practiced and I
Yeah,
sutured the sponge
yeah.
to death.
Yes. No, because again,
um,
you are sharing some of these things in your, social media pages. Because
yes,
I
I
do remember
was.
at some point you were like showing yourself, suturing
Yes,
some of those
the
sponges.
sponge.
And I
Yes.
also understand that them taking you to a kitchen was not your, a very good thingy, because you and the kitchen are not in the same WhatsApp group.
No, not at all. So when my mother found out that I had made biscuits, she was like, "Oh, okay, well that's a good thing, because
Yeah,
maybe when you come out of there, you're gonna have some new skills, and
yeah.
maybe you'll now start liking the kitchen." But no, it wasn't a cure for that. I'm still not. I'm
You're still
terrible
challenged in that area.
completely challenged. That's irreparable.
All right. So, Doc, as we work towards wrapping up now,
Yes, yes.
um, so when you look back,
Mhm.
and obviously, okay, you got discharged,
Yes,
you
yes.
had to continue with rehab as an
With
outpatient.
outpatient rehab.
Yes.
Yes, yes.
So, how has that journey been?
It's been an amazing journey because the people that, so the outpatient rehab was actually done by a different group. And I'm very lucky that I'm in the medical space. So the guys that did the outpatient rehab are actually friends of mine, and they had called me and said, look, as soon as you are discharged, we want to see you. We want to see where you at, how far you are, and we want to take you the rest of the journey. So when I came out, it was overwhelming. People were phoning me and they were like, anything you need, you phone me and I will, I'll help you. So we continued, and very quickly, they got me through. They taught me how to walk properly now, not like a toddler. And eventually, because I couldn't drive when I was discharged, eventually we graduated to, okay, we're happy now with your walking, your coordination, etc. Now we'd like you to be able to drive yourself, and in that way we want to give you back your independence. Some of the other things as well is they had broken my tooth when they were intubating me, so I was hiding behind the mask a lot, and I had called my dentist and he said, no, you're not going to sit with the broken tooth. I need to give you a smile back. And then I went
that would have been a
sorted out.
problem for somebody who 90% of the time is smiling.
And it was so difficult for me. Like I said, I would hide behind the mask because it was, when I would look at myself in the mirror, it always felt like COVID has taken so much from me, including my ability to smile. So so I think the dentist was also part of the outpatient rehab program, but it's been amazing because I'm almost at full capacity now.
You haven't gone back.
We are. I'm starting next year. I haven't gone back yet. But basically, so what we're doing now is graded return to work. So the rehab is mostly done. So the reason why we're doing a graded return to work is so that I don't get overwhelmed, and that's why I'm saying I'm at full capacity. So they don't want you to go back and do a full day's work. So you start out slowly. So mornings you're going to do a certain number of days a week, and then you'll do half a day, and then etc. So that's where I am now.
So Doc, you definitely have had so much of challenges, but you have actually come out on tops. Anything that could be thrown in, you just managed to get through it. Yes, it was challenging, but you can look back and say, you know what, I've overcome things that many people would not have been able to overcome. But so when you're sitting alone and reflecting on this tough journey that you did not invite, but that came your way, and looking at life, the fragility of life, but also, the importance of hope and resilience and all. Just can you just tell us your thoughts about this tough journey that you have just gone through and your outlook to life?
Well, it's changed a lot of who I am. So I'm more grateful. Every day a friend of mine sent me a diary, and what I do is every day I write down 3 things that I'm grateful for. And I'm always grateful. The one thing that I'm always grateful for every day is I'm grateful for life. Then the other thing is I realized that I'm absolutely grateful about my friends and family, and I appreciate them more than anything. I would spend, sometimes I wouldn't call my parents for a week, and now I can't, because they almost lost me and I almost lost them, so I have a new appreciation for friends and family. But one of the things that I said to the ICU staff while I was still in ICU was, this experience will change the way I practice medicine. Being the patient, experiencing the things that I had done to other people. You know, I've put a drip on someone else, I've put an A-line on somebody else, I've put, you know, whatever. So the experience, now I know how patients feel when, you know, when we do these procedures to them. But also I know how it feels when somebody speaks to you in a certain way. And I know how I wanted people to speak to me. I know how I wanted people to treat me. And I need to treat people the exact same way. But the other thing that I was also saying was sometimes I could hear, you know, I would drift in and out of consciousness, and I would hear people speaking around me. And I said to the guys in my department that we need to be careful about what we say when we're in ICU, because you don't know that this person is, you know, fully in a coma and that they can't hear. I used to hear conversations. So when you're standing over somebody that's supposedly in a coma, be careful what you say to them, because that could actually be either encouraging or discouraging for the person, you know. And you know, we all know words are powerful.
Yes.
So for me, the one of the most important things is it's going to change the way I practice medicine when I go back.
More empathy, you know, going an extra
Absolutely.
mile, you know,
Yes.
lots of
Yes.
Ubuntu basically, you know,
Absolutely.
weaved in within your technical skills. Um,
Yes.
Tell me, are you a you know, as somebody who comes from a spiritual family, you know, I'm almost trying to ask if, in any way, you know, having gone to a Catholic school, those prayers and believing in God and stuff, did they play any role in your fighting for your life, the fight of your life, basically?
Mm. Okay, so yes, so I was in Catholic school, and you know, did a lot of the Catholic rituals. But I myself, my parents are very staunch Christians. So obviously, you know, they would take us to church, etc. More one of the charismatic churches.
Yes,
So I was never a Catholic, more
yes,
charismatic.
charismatic.
Um,
But still, it's Christianity.
unfortunately,
Yeah.
unfortunately, with work and, you know, our jobs, we are working all the time. So I won't even lie. I
Yeah.
hadn't been going to church much, except when I'm at home and my mother would drag
But
me
you
to
know
church.
what? It's not just about the physical being in the church. It's
Yes,
just the relationship
yes,
with the
yes.
guy. You know, with
With
the
the
guy.
higher power.
Yeah.
Yes. And I always say, so my thing is, um so for me it was always spirituality, you know,
Yeah.
where it's you have a relationship with a higher power,
Yeah.
whatever you call that higher power. So your higher power could be God, it could be Allah, it could be Buddha, it could be
Yeah.
anybody, but you
Yeah.
know, there's a higher power.
Yes.
When I was in ICU, I don't remember.
Mm.
Yeah, I'm not sure if
No, no,
you know,
no.
I
I'm sure.
can't remember those
I'm sure
parts.
your mom and dad were interceding for you. You know, praying on your behalf. I
Everybody.
mean, yeah.
Yes, no, the prayers were amazing. You know, I then found out later on that people's poor husbands were praying for this woman that they don't even know, because
Yeah.
some of the sisters would get home and say, you need to get down on your knees and pray for
Yeah.
Dr. Dube. And they're like,
Yeah.
who's Dr. Dube? And
Yeah.
no, she's a doctor in ICU. So there's a lot of people, you know, that were praying. I was told that people's home cells were
Yeah.
praying, churches, you know, people would get to church and say, there's this person that's in ICU fighting for her life. Can you
Mm.
please pray? So there's a lot of people that have
Mm.
never met me,
Yeah.
that might never meet me, that were just praying. And
Praying for you.
my mother actually said the one day, because my name is Nomthandazo, and my
Yeah.
mother's like, you know, what happened was it was almost like people were following your name, or your name became a reality, you
And
know.
maybe
But
this is the maybe it's the realization, because we say the name that you get given, by your
yes,
parents, at some point, you'll then understand why that particular name, either something that happened around the pregnancy and your birth, or something that they are wishing for, and in your case, Umthandazo could well be that it's one of those things that actually gave you that extra power, even though Gabriel was making multiple visits,
Yes. Yes. Well, when I was born, my mother went into kidney failure. So so I was wheeled one direction, my mom was wheeled into oh shoot.
Doc, just switch on your camera.
Yeah, I'm sorry. I need to.
Okay.
Hi.
Yeah, no, I can see
Sorry
you.
about that. I don't know what happened.
4 minutes to go.
I'm sorry. I don't know what happened. But so I was named Nomthandazo because they were praying at the time when I was born, because my mother went into renal failure. So my name has sort of
a lot of meaning now.
Yes, so it was then and now, and also now. They also had to pray a lot.
Yes, all right. So, Doc, I didn't spend much time, on the issue of rehab, and I really don't want to go there now. But as medical doctors, we go through our undergrad training. We tend to focus a lot within the space of medical, professions, or medical profession. Yeah. Now, but there are fields that we work with, the OTs, the physios, the speech therapists, and, all of these part of the health team.
Yes.
And we tend not to appreciate or understand what they do until either you or somebody close to you requires those kind of services. And all of a sudden, your mind is opened about how valuable these members of the team. So in your experience, what would you want to say, about, that army of, rehab therapists that you actually were with for a couple of months and you are still with even now?
Yeah. So I'm lucky that because of the neurosurgery, I had actually been working with some therapists. So already I was in a multidisciplinary situation, but I don't think I quite appreciated them until I needed them. So I knew, we need a physiotherapist, we need an occupational therapist, we need a speech therapist.
Yeah.
But for us to treat patients, it has to be holistic. And yes, I was out of the woods clinically. I was out of the woods. I no longer needed a ventilator. But if I didn't have the physiotherapist helping me, to walk, to relearn to walk, if I didn't have the occupational therapist, if I didn't have my speech therapist, I'd still, I wouldn't be where I am. I wouldn't be able to now say I'm, almost ready to go back to work and work at probably the same capacity that I was working at before I was admitted. So we don't appreciate them, but they are a very, very integral part of what we do, So once you've done your part, and in my case, once I've operated, it's very important. Rehabilitation is one of the very, very important things. And I am forever grateful to the rehabilitation team, both inpatient rehabilitation team and outpatient rehabilitation teams. Yes.
Well, our friend Ritabile has sent a message here, and I think I need to read it for you. This was a very scary period. We kept on receiving bad news after bad news, but we never lost hope. Nomthandazo is a fighter. We knew she was going to fight. So even though you were in coma there, they knew that you are going to fight and actually succeed, and you have, And there's also Nyembezi Mosite. She says, you always speak so well, Thandazo. So you've got a lot of people who were praying for you, like you have already said, people who wanted to make sure that you come back. And I saw a picture on Ritabile's Facebook timeline that you guys had something this past Friday.
on Friday.
Your Matosa top and Angenile, Doc.
Well, I haven't been out. I mean, I've probably been out a total of like 3 times because I still have anxiety.
Yeah.
You know, about being out in public and being with a lot of people. But the lady whose birthday we had attended is actually the lady I was talking about. Dr. Mutse, Kagiso Mutse, she's a nephrologist. She's actually the one that suggested that I test for COVID. So there was no way that I was not going to go and celebrate her birthday. And, you know, also needed to look a little bit cute, you know, not look like I just stepped.
You know, stepping out to the world, Matosa, out. But anyway, Doc, we've been speaking for about 90 minutes. Let's test our people. You really have been a very great guest, very motivational journey to you. You know, your journey to being a neurosurgeon was not an easy one, but actually persevered. You focused on the end goal, and you actually got it. Yeah, and your, you know, this situation with COVID, you were given lemons and you've made lemonade out of them. So I think there are very few things that should scare you now. And you must also know that there's definitely a lot of protection that you have.
Absolutely.
So with those words, Doc, I really want to thank you for allowing us to just, you know, listen to your story, share it with the rest of the people, but more importantly, to say you don't have to have comorbid disorders or be old to actually have a severe form, you know, of the COVID-19 disease. As we are in the middle of the second wave, you know, with a lot of people having the COVID fatigue, and others actually just, you know, consciously not wanting to take the precautions, people must know that it's a matter of life and death. You know, the decisions we make as we get to the silly season about our lives, who we visit, you know, what we do when we are with those people, whether they are family or not, can be a difference in terms of whether we actually get to 2021 in one piece or not, you know.
Absolutely.
So I'm basically saying your story, it's so important at this point to actually just say to the people, it could have been anybody. This time it was you. And, you know, things happen. Sometimes there's a lesson in that, not just for you, but for all of us. So really, really thank you for being selfless to share your story. And may you continue to do good. You are a better version of yourself for a reason. And yeah, so I will continue to watch your journey as you continue, you know, to make the other gender proud. You know, yeah. So, Doc, thank you very much, man. I also want to thank all of the people who tuned in via the multiple social media platforms. And I just want to say to them, thank you, thank you, thank you. We need people like Dr. Dube to just bring us to our senses. And hopefully, from listening to her story, you will go back and mask up and sanitize and avoid those gatherings, especially in closed spaces. You just treat yourself as being in level 4 or 5, even though the government is still keeping us at level 1. So thank you, Doc, and thank you to everybody who joined us.
Thank you so much. And have a good evening. Thank you.
Thank you, Doc. And I will share the YouTube you know, recording sometime today.
Thank you.
Thank you. Lovely.
Okay. Bye.